Hi everyone, Hannah here. Welcome back to episode 7 of the Data Source series, a series where we discuss a series of data sources. This week we're going to be talking about Medicare Part B, Medicare Part D, and Medicaid. If you enjoy the video, find it useful, or have any questions, make sure to leave a comment down below, like the video, and subscribe to catch the next videos in the series. Thank you.
Hello.
Hello.
Good morning.
Hi, Shanmugam. How are you doing?
Very good. Nice and sunny weather in
Shanmugam,
Chicago.
I think we want to talk about Medicare data
Yes.
and Medicaid data.
Yes.
So, a lot of those projects that we do, we know that the representation in the PLD is, let's say, not ideal in terms of capture rate.
Mm-hmm.
And these databases very well, the Medicare and Medicaid. I think we can kind of describe it a little bit, maybe show some examples, Medicare, Medicaid, but the data source. What do you think?
Absolutely. Yeah. Can ask for a better time because Medicare released their Part B and D just 10 days ago.
Oh, wow. That's very good.
Yeah.
And I think the reason I think Medicare could be very interesting is because they break down the data by physician.
Exactly. Yeah.
Right. So you get the name and the NPI of the physician, each physician at a time.
Yes.
And both on the Part B side and the Part D side.
Exactly.
Which is very interesting.
Yeah, we can see at the rendering provider level, which is the location that they are discharging, giving those services.
Yeah.
Yeah, by HCPCS and by.
So the only caveat, Shanmugam, is for the Part B, it's only the FFS side,
Exactly.
right? So we don't have the managed, but maybe that's okay, right?
Yes, but for the Part D, we have PDP and MAPD. Correct.
And I believe there's some kind of things we need to be cognizant of, is kind of those suppression rules.
Yeah.
If there are less than 10 beneficiaries, then they won't give you the data.
Yeah.
And if the 10, kind of more than 11 or more, then you get the data.
Yes.
Right.
Yes. So the suppression rule is moved from the. So they have the claims and also services in Part D.
So that's in Part D.
Yeah.
Right.
Part B, the services, if it's less than 11, you can see it.
Yeah.
And if it's Part D, if the claims is less than 11, more than 11, you can see it. So,
right.
Yeah.
But then it's kind of interesting if the number of beneficiaries would be less than 10, then if the claims are more than 11, then you get to see it.
Yes.
Right. They hide the beneficiaries at kind of 2 level for Part D, whereas for Part B you have only like 1 level, which is the beneficiary.
Yeah.
So it's kind of interesting.
Have a blank space for beneficiary.
Yeah. And then the kind of the Medicaid data. This time we don't have the breakout by physician, but you have it at the state level.
Correct.
Right.
Yeah, that's the caveat.
But I think it's interesting because you have it broken out by NDC code.
Yeah.
Right. Yeah. And at the same time, they have the suppression rules. It means that maybe if they had reported a drug, you would see the whole thing. But then since they break it out by NDC, then the suppression would kick in for an NDC code. So the drug has 10 different NDC codes, and maybe kind of suppression would apply to rare versions of the NDC code. And then this one gets suppressed. You get to see the 7 one.
Yeah.
But if we had the drug name, then you'll get the whole picture.
Exactly.
Right. Yeah. But this time, the NDC is kind of both a blessing and a curse at the same time.
Yeah.
Right.
Yeah. That's a good perspective. Yes.
Yeah. Okay.
Right.
So without further ado, maybe we can kind of go and show some of the data, and it's very, very good data.
Absolutely. I prepared some snippets and some views based on our Chicago geography.
Oh, okay.
Yeah.
Okay.
Yeah, we'll be happy to show that.
Okay, cool. Let's do it.
Yeah, let's dive in. Okay, so this is the some background about the Medicare file JP, Part B and D. Okay. So, like I was mentioning, Part B captures fee for service 100%. Right,
and no advantage.
No advantage.
Okay.
So, but D spreads the wings in terms of capturing both PDP and
MAPD. Right.
Right.
Yeah. Okay. Very good.
And as we can see, the Part D actually is comprised of 77% of all the Medicare beneficiaries.
So it means that 1 of 4 people they don't buy any Part D. They say, okay, forget about the drug. I'm healthy. I'm not going to use any drug.
Yes.
Right.
Right.
Or maybe I don't have the money to buy it.
Right.
Okay.
And out of the Part D data set, we saw that 46% of the Part D beneficiaries are enrolled in PDP, a little higher for the Medicare Advantage.
Right, because people like Part C, right? That's
Yeah.
why kind of 55-45.
Exactly.
So it kind of makes sense.
Yes. And to actually talk about the Part B, like
So
I
we'll
mentioned,
focus on B now.
yes.
Okay.
Yes. So since this was released in 2023, it was for the calendar year 2023. We just got the data as we focus on only fee-for-service.
You said just a few days ago we have this one?
Yeah, 10 days.
Oh, wow.
Right.
Interesting. Yeah.
So, and then we can break it out by HCPCS picks. And there are about 10 million records, and we see the average submitted charge, average allowed amount, and how much Medicare actually paid. And we have the suppression rule. So let me give you an overview of that file directly. So so this is the Medicare file JP Part B. As you can see, there's a NPI, and then we see the physician.
So the first one is the rendering doctor. So the doctor actually doing the job.
Yeah.
Right.
So we see the rendering physician. Where is he providing
so
the service?
Sorin Dansu would be your first doctor in that.
Correct.
That list.
Yeah.
Okay.
I separated this file because it just focuses on physicians in the Chicago area. And we see the.
So he's a cardiologist.
Yeah.
Okay.
Cardiologist, and then we see the HCPCS here.
Okay.
So we see the description as well.
Insertion of the needle, the scan of the heart, and scan. CT scan of blood vessels, blah blah blah. Right?
Yeah, ultrasound, and if it's an office visit. And I like this flag specifically.
It's not a drug.
Yeah, if it's drug or not.
Yeah.
So we can filter out the J codes by doing that.
Yep.
And if it's the place of service, is it outpatient or facility, which is inpatient? And then the most important part are the number of beneficiaries.
So those are the patients that the physician treated over the year.
Yeah.
Right.
For the entire calendar year.
Yeah.
And how many services that they gave.
So services is because a patient received maybe 2 or more services. Yeah. That's right. The number of services would always be higher than the beneficiaries, right?
Correct. Yeah.
Okay.
Yeah. And
the beneficiary, we don't always see them, right? If it was less than 10 people or less, then it kind of we won't see that.
Yes.
So it means that it's always 11 or more.
Yes.
Right? So the entire database.
Correct.
Right?
Yeah.
Cool.
And we see the submitted charge, what is the allowed amount, and what do they actually pay.
Yeah.
So, and then what is the standardized amount?
Standard deviation, right?
Right.
Yeah.
So standardized amount. So if you multiply these both, the average Medicare payment and the services, you'll get the total payment. Right. That's how we.
So basically, you have to multiply it by the number of services, right?
Yes.
To get it, they compute the average.
Yeah.
Right.
Yeah. Exactly.
So this is a very kind of give you a good sense of how much the doctor is receiving, and then also it tells you there's a difference between submitted and actually paid, and it goes through the max allowed.
Yeah.
And sometimes we see that the payment is below the max allowed, right?
Yeah.
So for example, the second one is 91.5, but it's 114.8.
Yeah.
Right. So I think it brings a kind of different perspective or different kind of, you can dig a little further.
Exactly.
You also understand the mechanism of the payment a little bit in that stuff.
Yep. Pretty good.
So that's at the physician level.
Yes.
Very nice.
Good.
Let's move on.
Yeah. So this is the Part D. As I know, 10 days ago is when they released the 2023 data as well.
Yes.
It's both PDP and MAPD.
Yeah.
It's more towards MAPD. And there's no NDC codes, but we'll see the drug names. And we have the claims as well, the 30-day fills, days supply, drugs cost, and the beneficiaries too. So the drugs were totally 183 billion. And maybe I'll show you an actual.
Yeah, let's look at the Excel. I think we'll understand.
Yes. So this is the Part D.
So the structure is very much like the Part B, right?
Yes. It starts. I know it might be the same physician because we chose the city.
In Chicago.
Yeah.
Right.
So we see the specialty, and we see the drugs here. So.
So I can see that we have both the branded name and the generic name.
Correct.
Right?
Yes.
The drug.
So we see them, and we have the claims, right? And we have the beneficiaries further down. We have the total beneficiaries, what is the day supply, the 30-day
So in the
fills.
beneficiaries if you look at the third row, Shanmugam, the
Yeah.
new beneficiaries, it means 10 or less.
Right.
But then you still have the claims, the
Exactly.
15 claims.
Yep.
Now that kind of two level of suppression in there, right?
Exactly.
Nice.
Yes.
Uh-huh.
So that's why there's gaps here as
Yeah,
well.
yeah, yeah.
Right. Awesome. Yeah, good catch, JP. And
then we have, it's kind of interesting, they look at those that are older than 65, they call them out separately,
right.
right?
Yeah. So they have a separate bucket for them, and you have the same set of breakdown for the people who are
interesting that
more than
they
65.
would also talk about day supply as well. So
Yes.
that's
Right.
interesting, right? To know
Yeah.
if they're more like 30 days or 90 days, that kind of stuff.
Exactly. Yeah. Yeah, this is a very good data set. And
so once again, this is at the doctor level.
yeah,
and this is PDP, MAPD.
yes.
But they don't break it out. They don't tell you
Right.
this is PDP, this is MAPD, kind of
Right.
it's all lumped.
Yeah.
Right?
Yeah. Like Medicare is a good option where Medicaid, is where you'd see the breakdown between Medicare. So this is actually, we compare the Medicaid versus the Part D, where Medicaid goes into at the NDC level, and it also includes MAPD and
FFS and managed care, right?
Correct.
So
Yeah,
the
FFS.
equivalent, the same thing, but for
Yes.
Medicaid.
Correct. They call it FFSU, and then
U for utilization, right?
utilization. Yeah.
Okay.
And then MCOU. So those are the two fields. This is actually the Medicaid file.
Yeah.
And we can
see the NDC code right there, right?
Yeah. And it's broken out by state. And
so the doctor has disappeared.
Yes.
There's no doctor, right?
A little higher level. So we see for 2024, we have the first and
second quarter,
just 2 quarters.
Yeah, yeah.
And the suppression flag.
So like less than a year behind, because today we're in May.
Exactly.
This is second quarter, meaning June.
Yes.
So it's less than 1 year old.
Yes. So that's
right.
I know Medicaid.
Because normally for me, Medicaid's kind of 3-4 years old, but this is actually more recent than Medicare.
Yeah, exactly.
Which is kind of, for me, it's kind of a little counterintuitive.
Yes, exactly. Which is such a blessing. And they track all the drugs and the units reimbursed, number of prescriptions, the total amount. They don't go by the average amount. They have the actual total amount reimbursed.
And they just talk about number of prescriptions.
Yes, yes.
Right?
So,
and it's interesting that in terms of Medicaid, you have the amount which is reimbursed by Medicaid, and then the amount that is not reimbursed by Medicaid, but they kind of keep track of it, right? So for example, if I pay out of pocket, they would keep track of how much I pay, and that would appear in the non-Medicaid amount, right? Among other things, right?
Yeah.
Which is kind of interesting, right? Because you would think that me, kind of only the Medicaid chunk of the money. No. Non-Medicaid is represented as well.
Exactly. Yeah. So the dual eligibles and the patient out of pocket.
Which it could be anything like Medicare is paying for that.
Study between the FFS population versus.
And this one we're looking at the FFS or the MCOU. This one.
So this is FFS.
Okay, the fee for service.
Right. And as you can see, the column was kind of higher amounts, correct?
Yeah.
But if you see the MCOU, you'd see a
much
much
smaller, right?
Right. Much drop. The drop is steep.
Yeah.
Right.
Right.
Yes.
So kind of reflecting on this, we have the breakout between fee for service and managed.
Yeah.
Right. And we don't have the doctor.
Yeah.
But we have all the states.
Yes.
Indeed, which is, and this is a good thing, because before, not all the states would give you the data. I think it was like 43 states or something like this, and this one you have all 50 states.
Exactly.
It's more recent. You get the money, the number of prescriptions.
Yes.
And you can really use that data for all our projects where you use PLD, right? I mean, you see the holes and all that stuff.
2 big payers. Yeah, absolutely. And the data is pretty recent. And the people tend to maintain a trend as well. So awesome.
This is perfect, Shanmugam. Thank you very much for this
Hope that
interesting deep dive in the
awesome
in the data. Yeah. Thank you.
Thank you.
Bye-bye.